Hey guys, what's going on? This is John from Friends with Your Benefits. I don't know about you, but lately I've been finding that it's really hard to actually get an appointment with my primary care provider, or perhaps, let's say, if something a little more urgent going on. When I go to urgent care, I find that I'm waiting a lot of time. Perhaps I'm in a germy waiting room, and I'm not always getting the care that I really need and candidly deserve. Recently, I came across a vendor in the marketplace called CirrusMD that provides virtual primary care, and they promise you'll get access to a primary care provider very quickly. Joining us today to learn more about that, we have Donna Baldwin, the Chief Quality and Innovation Officer at CirrusMD. Hey, Donna, how's it going? Welcome to the show.
Thanks, John. I'm happy to be here.
So Donna, just to, I guess, have our audience get to know you a little bit better, right? So can you tell our audience a little bit about your background and perhaps your favorite thing about practicing medicine?
Sure. So I'm a family medicine physician, board certified in family medicine as well as medical acupuncture. And I've been practicing for about 20 years. My career actually started, I was fortunate enough to work for a medical group that paid me as a salary. So I was enhanced to really take care of patients however I wanted to. So I would schedule phone visits with my patients. We would chat over secure email, and
Hmm.
really found that that met the needs of my patients without them having to take time off work or come see me in person, especially if I just needed to relay a result of a lab or make a small change in their care plan or their medication. So really started doing digital healthcare from the very beginning of my career.
Hmm.
I love working at CirrusMD because I get to do it full time now.
There you go. What were some of those early days like, right? Telemedicine, right? If you think about it, maybe 5, 10 years ago, what was it like compared to now?
Well, certainly things have changed over the years, and the pandemic really brought to the forefront our ability to innovate healthcare using digital resources. Certainly video visits, phone visits, email has been around for the last decade or so, but has been markedly underutilized. And some of that has to do with how physicians are paid. Now that the pandemic is hopefully behind us, we can now have changes in legislation and regulations and how physicians can get actually reimbursed for
Hmm.
providing digital health care. So definitely changes in reimbursement have made digital healthcare more popular.
So that's definitely really interesting, right? So I don't know about you, but I've been hearing this new term in the marketplace called virtual primary care. So how does candidly virtual primary care compare to the broad brush view of, quote unquote telemedicine? And when I think of telemedicine, right, my kid gets pink eye, I kind of call and I get that script. So can you just give our audience just a little bit of insight just in terms of how virtual primary care varies compared to telemedicine, if you don't mind?
Sure. So I'll compare it to a brick and mortar primary care practice. So, as a family medicine
Hmm.
physician, I see patients for acute visits, so pink eye, injuries, things like that. But I also see them for behavioral health concerns, depression, anxiety, high blood pressure, diabetes, and so my day is filled with a variety of conditions. In fact, I just saw a lady yesterday on virtual care who presented with hives, which you think of as an acute
Wow.
visit. Interestingly, her hives were not caused by a change in detergent or a change in something she ate, but really, after further talking with her, it really was more about her stress and anxiety that she was experiencing. So, as you can see, a primary care visit can involve acute issues, but also can involve other chronic issues or more substantial issues that is not just urgent. So primary care really involves all kinds of conditions.
Sure. One criticism I guess I've heard of, virtual primary care, and I'd love your perspective on this, from some, doctors out there, is they say, hey, John, the technology is great, but I guess the limiting factor is you can't check people's blood pressure. What do you say to that?
Well, I think that our society in the United States has become very savvy at digital tools. Most people
Hmm.
will have a blood pressure cuff in their home to check their blood pressure. A lot of people have these things, right? That can check
Yeah.
your oxygen level, can check your pulse. So there's a lot of tools available. People have scales. People could even buy a pulse ox online. In addition to that, you can also get tools like otoscopes, meaning that you can get a device that you can actually put in your ear that can take a picture or a video that can be easily uploaded. So the devices
Really?
and health devices are widespread and easily
Hmm.
accessible to folks. So makes it so that digital healthcare can be more effective because I can ask them what their blood pressure is and they can upload it. In fact, when you're talking about metrics for health plans called HEDIS metrics,
Hmm.
home blood pressure measurements now are accepted as forms of documentation for blood pressure. They don't have to come into the office to have me check their blood pressure.
I didn't know that. It's very interesting. So do you actually, let's say I'm taking my blood pressure. Do you just take my word for it? Do you actually have to watch me put the blood pressure cuff on?
Well, certainly I want to make sure you're doing it right and you're using the
Sure.
right size cuff for yourself. And so we'll talk about that. I have videos that I could send you as well so you can see that. It's always good practice to ensure that you are measuring it correctly. And so we do check that out. And some people like to take pictures of their actual machine and send it to me, but certainly self-reported blood pressures, as long as I'm sure that you're doing it right with the right size cuff, is acceptable.
Fair enough. You might have to double check mine, candidly, just to make sure that I'm doing it correctly, but all good, Donna.
Happy to.
Cool. So I guess let's talk a little bit more about virtual primary care and CirrusMD, right? So we talked a little bit about the theory, but you have a patient there. How do they actually go about accessing CirrusMD?
Sure. So we try to make it as easy as possible. Access to healthcare presents a lot of barriers for folks. And so, how can we make that easy? It's really using CirrusMD is really as easy as texting a friend. You can use the
Hmm.
app on your phone, your smartphone, which 85% of all Americans have one. You
Yep.
don't need broadband access. You can easily use your data. Or you can use the web on your desktop. So you register and you can immediately start a chat. And that we can move into voice or video as needed, and less than 60 seconds. In fact, last year, you're connected to a physician in about 15 seconds in
Wow.
2022. It's a pretty wow experience. It's very interesting because the patients will often say, "Am I really talking to a doctor?" They really are surprised at how quickly that happens. And it's not just about connecting to a doctor in that amount of time, but really the interaction. Just because it's a text or a chat, a secure chat,
Sure.
doesn't mean that there's lags in communication. And so we
Okay.
have studied on our platform how fast the doctor gets back to you and what that actually looks like. People used to call chat asynchronous. It's not asynchronous at all. It's very synchronous. In
Hmm.
fact, what our data shows is that every 52 seconds, the doctor is chatting back with you. So it's very much an ongoing conversation and really at the patient's speed. We're available 365, 24/7, really flips the healthcare on its head. You used to have to schedule an appointment when the doctor was ready for you and
Yep.
during a doctor's office hours. You don't have to do that with CirrusMD. If you have a concern or a need, you get right on and you get right connected with a doctor very quickly. So it's very patient centered, and we really want to make sure we're there when you need it, not just when we're available.
So there's not like that virtual waiting room or, to paraphrase the customer service numbers you call up, your call is important to us. There's none of that?
No, and what we believe is that having a physician first and a physician led care experience, although the physician is one of the most costly, resources in the healthcare system, really helps us reduce that cost or waste. So imagine that you hurt your back and you don't know
Mhm.
how or what you should do. Should you go see a back specialist? Should you go see physical therapy? And you're just not sure. In fact, one of our clients, Mercer, really uses different point solutions to help. So, for example, you may have availability to go into a virtual physical therapy appointment, but
Hmm.
you don't know what you're supposed to do. So that's where CirrusMD comes in. Let us be your digital first stop for any medical concern. You come on, you talk to me about your back pain, and I'll say, John, I don't think you need to see orthopedics, but I think you'd benefit from an offering that Mercer might have for you, like Hinge Health.
Hmm.
And so we'll get you connected that way. So really saves time and money and gets you connected right away. I think about, if you go to a restaurant and you have this giant menu and you ask the wait
Yep.
staff, hey, what's good here? And they
Yeah.
say, I don't know, everything is. That can be very confusing for you, as you want to know what's good before you order it. So CirrusMD sees our role in the same way. Getting connected to a physician quickly and easily, we can get to you to the solution of your problem, if not solve it in that visit.
No, very interesting. Donna, I guess just as a follow-up, one criticism I've heard of, I guess, telehealth, and I'll put, virtual primary care in there as well, is some people say, oh, virtual primary care or telehealth can really just be a pill mill, right, for people to get antibiotics, and maybe there's overuse of antibiotics, and we know there's certainly shortages out there. Does CirrusMD help to kind of prevent that?
Yeah, so as the chief quality officer, this is near and dear to my heart for sure. So, what we've done is we've established over 70 best practices rooted in evidence based medicine. And so, as a foundation, our physicians use these to help guide care. Um, our prescribing rates are actually pretty low at CirrusMD.
Hmm.
Only about 25% of the time is a prescription given. And you might say, well, gosh, do the patients feel valued, that their visit was
Hmm.
valued if they didn't get something? And really and truly, our patient satisfaction is 95% in 2022. So we have something secret going on. That's connecting with a physician right away, establishing a trusted relationship, and then being able to spend the time to educate them. Our physicians aren't paid by the encounter, so it's not a productivity based thing. So I'm not incented to hurry up and get to the next patient.
Hmm.
Our average visit time is about 25 minutes, and that's patient guided.
That's a
So
long time.
I spend a lot of time educating, listening, understanding, and really creating that trust, so that the expectation of an antibiotic, let's say, is not something that ends up happening. In fact, only 8% of all prescriptions were antibiotics last year.
Wow. That's incredible. Donna, where do you see the future of virtual primary care going over the next 5, maybe 10 years?
That's a great question. I think as digital health becomes a more commonplace for the consumer, meaning the patients, they're going to push us to want to have more care delivered in this way. Why? They want it convenient. They want it on their time, and they're questioning: do I really need to go in and see someone and waste an entire half day or full day of work when I used to get it over digital health during the pandemic? So I think it's really going to be pushed to provide more and more care and be more innovative. I think the concern is that, are we fragmenting the healthcare system even more? So
Sure.
when about 10 years ago, urgent cares popped up, right? And everyone's like, this is great. I can go and see a doctor, I can go and see a provider and get my acute need taken care of whenever it's convenient for me. But how did that information get back to your primary care physician, who is, in a sense, the quarterback of your care? So it fragmented healthcare. And so patients were getting care here, there, and everywhere, and nothing was coordinated. So digital primary care needs to be coordinated with the existing healthcare ecosystem. It can't sit alone, and it can't be a part of the overall care plans. So digital healthcare needs to and digital primary care needs to really be collaborative, and
Hmm.
it needs to be very much a part of what happens in the brick and mortar and other places.
No, really appreciate your perspective on that, Donna. So let's say there's an employer out there and they want to learn more about CirrusMD, or perhaps they want to connect with you directly. Where can they go to learn more information?
So certainly our website, cirrusmd.com, has contact forms, and can get an employer a demo, more information, and certainly connect with myself or any of our staff. It also has resources in it that goes through all of our clinical studies, research, white papers, all the great things that we're doing. Because at CirrusMD, it's not just about providing care, it's about demonstrating the care that we provide actually is making a difference in health outcomes and in people's lives.
Cool. Well, Donna, thank you very much for coming on the show today. I really appreciate your candidness as it relates to the conversation and the future of virtual primary care.
Thanks for having me. It's a great conversation.
Absolutely. And for our viewers out there, we want to hear from you guys. What do you think of the future of virtual primary care? And is this something that you'd perhaps implement for your employees? Comment below.